More than 71,000 children under 5 in Gaza are at risk of acute malnutrition. That's according to Gaza Rights Center. Inside several hospitals across the war-torn enclave, doctors are treating an increasing number of severely malnourished children. And there are growing concerns over the survival of these vulnerable children.
My son suffers from multiple health conditions. He has cerebral atrophy and is completely immobile. He also struggles with severe feeding difficulties and is unable to eat any solid food.
Before the war, the medical charity group Doctors Without Borders says malnutrition among children was almost non-existent. That changed, however, not long after Israel began its war on Gaza, with cases first identified in January 2024.
Children have been directly impacted by a policy of starvation. A growing number of children are suffering from malnutrition, while the nutritional products and supplements essential for both prevention and treatment have become unavailable.
Aid and food shortages remain key drivers of the crisis, according to humanitarian and medical sources. In Gaza, the risk of malnutrition is no longer limited to the most vulnerable cases. It is spreading as shortages persist. Doctors also warn that unless aid and nutritional supplies are urgently allowed in at sufficient levels, the lives of thousands of children would remain at serious risk.
The crisis remains ongoing. Sufficient aid is not allowed in, and the cost of living has risen dramatically, leaving many fathers unable to provide even the most basic necessities for their families. These conditions are having a deeply harmful impact on both breastfeeding mothers and young children.
By late 2025, the UN estimated around 3/4 of the population in Gaza were said to be facing high levels of acute food insecurity. More than 150 children have already died from malnutrition since the start of the war. And rights groups warn that number could rise if the situation doesn't change.